one of the big challenges are there are plenty of vendors. The biggest challenge is interoperability in our country. During the tenure of my handling IT at St. John's, one of the challenges we had was getting systems, applications to talk to each other. And we did have our challenges and we couldn't fix them. So we continued to function in certain ways. And so for India, patients, what happens is if there's no interoperability, it means more costs. If they move from one hospital to another, they're asked to repeat tests, they're asked to do things all over again. So there's a business model to that. And patients are the end losers at the end of this. So I think having interoperability and ensuring that applications talk to each other is what is a way forward for India and healthcare IT. And that's absolutely.
How about the healthcare providers, the community of healthcare providers? Are they able to adapt?
Well, there are groups which have taken initiatives to include interoperability in their architecture, but there are groups who are absolutely ignorant. I've seen the entire spectrum. There are groups willing to learn, and I'm sure platforms like the IMI and experts like yourselves and many others who have the experience who really can put together this platform and create a movement, hopefully to push people and vendors to be aware and adopt this kind of technology.
Is it an expensive proposition to have an interoperable system in a hospital?
I don't think so, because, for example, the government of India has made certain coding free, like Snowman CT is absolutely free for you. So there's no expense. It's all about getting aware about the whole interoperable issues and then working towards it. So I think companies and vendors will be happy to adopt it and include it into a system as a selling point as well. And of course, probably you're also aware that the government is setting up standards, and it's only in time that vendors will have to be compliant one way or other. So I think we're heading in the right direction.
Good. How about innovation, doctor? Are there innovations happening wherever you go?
Yeah, I think healthcare IT innovations is a huge boom in the country. Proof of it is you're in Koromangala, if you look around within a 3-kilometer radius of St. John's, you realize there are so many companies who are already in healthcare IT innovation, working on different problems. We at St. John's itself are working on these 2 innovative ideas and working with startups to work in that direction. And I see even in those areas, interoperability is an important aspect.
So as a practitioner of interoperability standards here in St. John's, what would be your advice to your neighboring stakeholders?
Well, get onto the bandwagon as soon as possible or you'll perish.